Firing the top vaccine official in the state is disturbing news for physicians all across our state. Doctors are speaking out about that and the Department of Health's decision when it comes to vaccination awareness. News 4's Tosin Fakile joins us now. And Tosin, doctors are calling for legal action, right?
That's exactly what they're doing. They're saying these actions are endangering the public, and doctors are calling for the Department of Justice to do an independent investigation into Governor Bill Lee's actions that they're calling reckless misconduct and suppression of public health and the firing of Dr. Michelle Fiscus.
I think what's happening right now is pure politics. And the unfortunate thing is that someone's going to die from it.
And trying to avoid more loss of life is what doctors in Tennessee say they want to prevent after seeing so many lives lost to the coronavirus.
Anytime the Department of Health has to step away from their mission, people are going to suffer. The patients are going to suffer. Doctors are going to find it harder to do their job.
Physicians we spoke to say firing Dr. Fiscus and the State Department of Health choosing not to have any immunization events in or at schools and not holding COVID-19 vaccine events will cost the state.
Having the Tennessee Department of Health not be able to work with us and really help us advocate and talk about the importance of vaccines to their children's health is really a big blow.
Firing Dr. Fiscus, who was just doing her job, just out there trying to promote scientifically proven vaccine adoption in kids to protect the public health, I think firing her is just unconscionable.
News 4 also found out Tennessee's Health Commissioner Dr. Lisa Piercy says there will be no outreach at all for National Immunization Awareness Month. That's also drawing reaction from medical professionals outside the state.
I'm very upset about it. As someone who survived polio and lived with polio for 29 years, this is not a disease that should be coming back by any means. This is not a disease we should stop advocating for the vaccines of.
For every year that our HPV vaccination rates are where they're at, you're looking at a good 1,200 to 1,400 future deaths.
Doctors call what's happening political, and they say the cost will be people's lives.
You know, most political games are just arguments between people, down at the Capitol building. But this has real life implications. You know, if there's a life-saving intervention in my practice and I withhold it, I get held to account legally. And I think the same standards should apply to the governor.
Now, a pediatrician we spoke to in that story, Dr. Butler, says baby and young children vaccination rates are going up, but it's not yet at pre-pandemic levels. He says where they're seeing a large gap is between older children and teenagers, and he says that means vaccines for things like HPV for cancers and meningitis, awareness for that is not getting out, and that's why the awareness has to come from the top. Back to you, Marius.
Tosin, thank you so much.